August gathering, and it's my pleasure to talk on an interesting subject, which is like the trendy subject which is going on in this current era. So I would like to project on the end-to-end digitization models which have evolved in the years and in the decades which we have been in the APAC countries. So it all starts earlier as a hospital, that the smart hospital concept is now all propagated, and many of the quaternary care hospitals are all going in this league, primarily to enhance the patient outcomes. So the journey of the patient and the capture of the data all starts earlier. It is all about when the patient is at home, when the smart ambulance picks up, and it's all the IoT devices which all gets the patient's data, gets real-time relayed to the hospital. So the planning and the decision making happens quite faster, and it's all linked to the different technologies, so that what happens in the EMS, in the OR, and in the radiology, there is a relay of information which happens seamless, and all these technologies are all integrated. So that's something which are all on the integrated and the continuum of care, which is the need of an hour. And as a hospital, we have been driving this, and that is actually linked to the different patient outcomes. So we have seen a lot of impact in the door to balloon time, door to needle time in the stroke. So this is something where on the window period of stroke and all, it's really helpful, and that has really brought down a lot of impact in the patient's lives. So that's something which we have seen. And secondly, if we go to the next level in the APAC countries, if it's all about how much is the HIMSS level adoptions. So that's something which is of importance in all the countries, and in some countries it's also linked to the reimbursements. So with the HIMSS level being higher, say 5 or 6 or higher, it really helps in getting better reimbursements. While this is not been there in almost all the countries, but it's been adopted and embraced by the regulatory authorities, so that there is some amount of data flow which happens, and that is really getting captured across the continuum of care events in the patient's life. So I believe it's all about how are we able to tap the data, and we're able to bring in efficiencies in place.
Oh, great. Thank you, Dr. Let's just move to Dr. Gupta. We just mentioned the impact of business transformation in patient outcomes. Could you please, Doctor, give us some details about how the business transformation could or contribute to improve patient outcomes in the healthcare sector in APAC region? The mic for you, Dr. Gupta.
Thank you so much, Dr. Ismail, and I thank the organizers of the Business Transformation Operational Excellence Conference, PITOPEX, and it's a really great program, and we're looking forward to have great discussion. It should be fruitful win-win for, I think, all the stakeholders. The question is, what will be the positive outcome on the patient care if we access to the business transformation or operational excellence, we work on that. In every area of business or in any institute or any business establishment, there are 7 or 8 functions like sales and marketing, operations. In case of healthcare, it is clinical operations, non-clinical operations, clinical operations. And like human resources includes recruitments, operational part, and also the training and development, legal and compliances, and payroll and all. If we talk about accounting and finance, R&D, research and development, there are all the functions that has to be there in any organization, and every function has an objective. In case of healthcare, if we talk about sales and marketing, definitely this is linked to the revenue and the profit. If we talk about the operation, then it is directly linked to the patient experience, quality of care, and safety of the patients. If we talk about the HR part, human resource part, then definitely this is right people at right time, right hiring, employee engagement, employee experience. These all. And if we talk about accounting and finance, definitely it is giving the data analytics, MIS reports, all the data insights, so that we can see the data, and according to data, we should change our strategy, modify strategy to achieve our goals. So these all functions are actually to be established, to be automated, to be enabled technology-wise, so that we can achieve objectives of each these functions. If we talk about the patient outcome, definitely if we do digital transformation, business transformation, or operational excellence, means the system process-driven hospital or healthcare services are there. I mean, each function has sub-functions, each sub-function has separate processes for it. And each process has clear-cut objective. The process is implemented, it is audited, is it reviewed every quarter, depending on the frequency. And after auditing, reviewing, if there is a re-engineering of process required, it should be re-engineered, revised, and definitely the process should be controlled through a technology-enabled system. It can be HIS, it can be EMR, it can be LIS, it can be OPD management system, it can be pharmacy management system, or there are so many modules in HIS, EMR. So these systems basically control the process of that institute or healthcare service department. If all these are enabled, and if now we are using like new enabled services like AI, artificial intelligence, AR, VR, machine learning, robotics, data analytics, definitely they will enhance the outcome of all these department, all these processes in terms of patient experience, quality of care, safety of the patients. There are three stakeholders if we talk about any healthcare system ecosystem. One, it's prime most important, patient care first. Number two, doctors and employees. Number three, promoters. And number four, now we talk about the insurance also players. There should be win-win situation for everybody. If we do business transformation, if we do operational excellence, it will improve the revenue generation part for the promoters. It will improve operational efficiency. It will improve EBITDA. It will improve patient engagement. It will improve the experience of the patient. If we talk about the second pillar, that is patient, they will have better experience. They will have reduced debt, as you already discussed in several slides. They will have better quality of care. The diagnosis will be accurate. There will be less medication error. The treatment will be specific, guided to the like disease or symptoms, and we will have better outcome. If there will be better engagement, if we like automate sales and marketing, education, awareness, engagement, re-engagement, compliance of the patient, they all will be improved. If we talk about the insurance, definitely they will have better transparency, trust will be there. The billing process will be trustworthy, it will be transparent, it will be open to each and everybody. And if we talk about the employee, definitely employee experience will be there. If HRMS, like human resource system, is automated, if there is a good HIS, good ERP, good LIS, definitely if you can, and if you have system and process that you have segregated deep division of labor in your institute, like you have specific KRAs, key responsibility for each employee, and they are mapped with the KPIs, and we are measuring KPIs and giving feedback them, reviewing them, giving support them, mentoring them, coaching them, engaging our employees. Definitely the outcome of employee will be very good. They will be very happy employee engagement will be better, attrition rate will be lower. Even like you can develop second line of team of like second line team of leaders in your institute. So it will be automating your system and process in your institute so that it will be managed accurately. It will be in automation. It will not require like higher management professional. They should be in a hospital. Like if we are managing chain of hospital, you cannot sit anywhere. So if you want to automate your system and process, definitely you have to develop skilled team members. You should have a good system and good processes. I think these all contribute to a very good ecosystem of a healthcare industry or healthcare perspective, so that we can provide patient better quality of care, better experience. We are a service industry. Healthcare is a service industry. And the prime most objective is to provide quality care, better experience, improved experience every day, every time, by improving all these we have discussed, as you have discussed in presentation, all these processes, system, structure, tracking, controlling. I think that's my point of view if we talk about all these stakeholders. Thank you so much. Couldn't get you.
You're on mute, Dr. Ismail. Yeah.
Oh, thank you so much, Dr. Gupta. Thank you, Dr. Serdar, for letting me know. Dr. Gupta, at the same context, please, could you just briefly tell us about the main drivers of operational excellence in healthcare sector in APAC region? Mike is yours.
Great question, Dr. Ismail. If we want to achieve operational excellence and business transformation, definitely we should know what is the growth, what are the growth drivers. Those can help to achieve business transformation or operational excellence in any institute, any country, any like industry, and that is very important. If we know these all things, the growth drivers, definitely we can work on them to achieve our long-term vision, long-term goals, long-term objectives. And for that, if we talk about first, prime most important is willpower. Willpower, willing to achieve operational excellence or transformation in the healthcare sector, healthcare industry, healthcare institute. That comes from the top roles, higher management, government, industry stakeholders, players, statutory bodies. If we all these have a great willpower, great vision, or achieving business transformation and operational excellence in healthcare sector, definitely that is the one most important factor of a most important growth driver, most important player, so that we can achieve. If there should be a strong thought in your mind if you want to achieve anything, and strong thoughts should be in the key players or key role models or leaders. Those thoughts can be conveyed to a second line team members or third line team members, so that thoughts should be converted into feelings, and those feelings should be converted into action to get the results. So this is the process where first this is a like key driver to achieve business transformation operations. Second key driver is technology enablement. This is the era of technology. This is the era of IT. This is the era of software. This is the era of HI. This is the era of LI. This is the era of AI. This is the era of robotics. This is the era of AR, VR, machine learning. If you are not competent enough, if you are not skilled enough, if you are not interested in all these things, you will be banished. You will be destroyed. You will be eliminated. You will be eradicated. If you want to survive, you have to be develop resources in your institute, in your department, in your sector, to utilize all these tools for business transformation, for operational excellence. Without these tools, you cannot operate. You cannot operate even you cannot provide a single point of care. You cannot provide quality care. You cannot provide better treatment. You cannot provide patient experience better. You cannot have a control on your system and processes. So I think second is technology transformation, and that include in case of healthcare, that is digital transformation. Means if somebody patient is roaming on a website, from a website till he reaches your hospital, he enters registration, billing, OPD consultation, IPD consultation, admission, lab, pharmacy, radiology, everything should be integrated. There should be interoperability in the system, so that everybody can communicate with each other. Every stakeholder should know about their patients, so that they can analyze the data. Data analytics should be there, so that based on data changes behavior, data drives behavior. Definitely you can improve the outcome and you can achieve the business transformation. We talk about the third factor that is most important, that I have already told you. Data is very important. Data analytics is very important. If you have data, it will give you insight. It will give you that actually results. On basis of result insight, you can plan, you can modify your decisions, you can change your strategy, you can review your strategy, you can review your past performance. Based on everything is data driven. So there are so many MIS reports that can be generated in different departments, be it operation, be it sales, be it marketing, be it finance, account, everything. Data, use Power BI, use good HIS, use LIS, integrate all these things and have some data dashboards for every stakeholder, be it a HOD, be it a senior manager, team leader, even like us, we are promoters, we should have control of each and every process. Each and every process, I think, not in process, you should have a control on each and every step of your every process. You should know how your process is moving. You can track, control in each and every process, so that you can control and track the experience of patient. You can control and track delivery services of a process. That can be done only through data analytics, only through the data measurements, and only through the MIS report. We third talk about definitely Technology, in terms of technology or in terms of software, we should have a good HIS system in our hospital healthcare system, good EHR, LIS, and the PACS and our CRM, customer patient engagement platforms. That there should be in HIS and ERP and all these things. There should be all the modules, all the ancillary modules. Because currently, in any APEC country, we don't have a good HIS, good control, good ERP for any healthcare service like hospitals or any healthcare service provider. They are good, but most of them lacking 1 or 2 or 3 or 5 modules. Because and so to complete this all solution, we should have integration with different modules, different data, different service providers, so that we have great solution with us. We can control all these processes and department with the great software tools. I think these are the few growth drivers, or like the drivers for the growth or drivers for the business transformation and operational excellence we have to adopt to achieve this, I think. Thank you so much.
Oh, great, Doctor. Thank you so much for all this so informative information. And I would like just to move to Dr. Sirda. As both of you doctors, you mentioned how this operational excellence and also business transformation could impact positively on patients' healthcare. However, Dr. Sirda, is there any, let's say, success experiences or stories from the region itself you would like to tell us about that?
Yeah. So that's a very good question, Dr. Ismail. So there have been a lot of used cases in the geography and across the globe on the AI and imaging. So that's something on the AI and radiology department, be it X-ray, CT, MRI. So we have been seeing that trend has been really taking off very well for the last a decade or so, and it's been primarily been boosted in the years to come. So that's something which we have seen that it may be used in the CT and the MRI and the PET scans, where it can really offload the clinician's work primarily, and we can see a drastic reduction in the turnaround time, which could be actually noted. The second use case is also in the digital upskilling and the simulation, because that's something which through the ARs and VRs are really being noted quite well. And this has actually been driven post-COVID, where a major study which also pointed out that 1 in 5 healthcare players have actually left the field. So that's something which was a problem statement post-COVID, where we could find that there was a need for upskilling, but at the same time we were seeing a kind of a healthcare player being leaving the field 1 in 5. So that's also some 20% which really gets eroded. And now I think over time this will all get covered up. But that's something which we have seen, that there is a need gap and been covered. Third is something on the, if we see the cloud and the SaaS software and solutions, most of the healthcare IT CXOs and CIOs actually feel that 87% of the solutions being offered are safe on cloud. So it's something which we feel that safety and security is one of the major aspects while we deliver the digital health, but this is being taken into consideration. The use cases also I could share about the ambulatory cardiac monitoring and all. We had actually a lot of wired kind of monitoring, but now it has come up with a very cozy models of Holter monitoring, and it actually gets into the ambulatory monitoring at home and real time relays by the IoT to the different clinicians. Same is the case with the diabetes monitoring. So a lot of diabetes monitoring have happened through the endocrinologist, and we could find that is something which is of a lot of importance, and we could find there have been a lot of use cases in that. So that is something on, and the other thing which is also on the patient navigation, which is for the hospital, which we found that the indoor mapping and the smarter navigations. So we do have as a Google map or any other maps which are all available in the market. But that's for external. But indoor hospital mapping and helping in the patient navigations, which we have also piloted. So that also helps in the better, smarter navigations. So these are all few of the cases which have been working very well in the hospital segment. Thank you, Dr. Ismail.
Thank you, Dr. Serdar. Yeah, it's a great examples, and absolutely we can touch and see how that impact already on patient healthcare and healthcare services delivery. Dr. Gupta, let me just ask you about. I like when you say we are at the era of technology, at the era of HIS, and all these examples you use it, and you confirmed how this period of history, it's the era of high technology and how that could impact on healthcare services. Doctor, we just mentioned briefly how these concepts could impact on cost saving in healthcare services. Could you just give us some details about how that could impact positively in healthcare services cost savings?
Definitely. Thank you so much, Dr. Ismail. If we talk about any business, any company, any institute, definitely one of the most important KRA of the top professional is cost saving, cost optimization, managing the top line and the bottom line, managing the EBITDA, I think managing the CAGR, they are all the KRAs of top professionals. If we are not able to manage all these things, I think it's the failure. If we talk about the technology enablement, if we talk about the HIS, if we talk about the LIS, if we talk about the tools that controls the system and processes, and they help in implementing all these processes at ground level, and that they help in the tracking and controlling each and every employee and each and every patient, each and every the document, each and every the lead, each and every the parameter. I think you will have insight, you will have operational efficiency improved in terms of like if you are implementing the KRA and you are measuring the KPI, definitely you can improve the operational efficiency of each and every employee. And it is not beneficial cost saving for the company. It is also like it's rewarding for the employee also in terms of they are having a skill to do good, improve their operational efficiency personally also. So I think in terms of if you are using all these system process tracking controls and in your department, in your company, definitely you could do cost optimization by reducing the cost in terms of manpower, by reducing the attrition rate, by reducing the investment on training and development repeatedly, and by seamless process and movement of the patients, definitely improving the rate, improving the revenue and improving the EBITDA, improving the cost, or like improving the cost efficiency. If you are using CRM, you can do patient engagement, you can do patient education, patient awareness that will reduce the attrition rate or chunk rate or burning rate, or for your patients, means your patient will be compliant to you. For not for the indoor services, they will avail our other services like lab, radiology, pharmacy, health checkup, so that you can generate more revenue. And if there is a higher top line, definitely it will impact your all the parameters of be it EBITDA top line or bottom line. If we talk about other factors, if you have data in front of you, you can see each and every department, how they are performing. If you have P&L of each and every department based on all these system and processes, you can identify where is the bottleneck system and process. After leveraging that bottleneck, you can streamline that process, you can review that process, you can re-engineer that process, and definitely you can improve the cost efficiency of that process only. We talk about the purchase process. If you have a good purchase process and there is a system to control that process, you can negotiate better. You can like compare to have a good comparison rate. You can find out where there is escalation or de-escalation of the rates. You can identify in each and every step of that process, even the turnaround time, lead time, everything can be controlled. So there is a enormous scope, huge scope of improving operational efficiency at each and every step of each and every process in every department. And after implementing all these things, you can reduce manpower, you can reduce fixed cost, you can reduce variable cost, you can improve your revenue, you can improve your net profit, you can improve your EBITDA. I think all these parameters, you can reduce the attrition rate. If everybody has separate KRAs, they are known about their KRAs, they are performing, everybody is measuring them. You are giving MIS report to each and every employee weekly, monthly, and if you are giving feedback, you are giving support, mentoring, coaching them, definitely engagement will be high, employee engagement will be high, attrition rate will be low, and training and development investment will be cost will be low. And the morale of the, just already you told me in your slides, morale of the organization will be very high, culture of the organization will be very high, everybody will be patient centric, we will be focusing on the patient actually, and we will not losing a single penny also, because if you have clinical pathways, they are controlled by the EHR. If you have like every lab and radiology department, everything is interlinked with the EHR and the PAC and the HIS, and definitely we will not miss a single investigation also. It will improve the patient outcome by improving their diagnosis, providing quality care, providing safe treatment, and it will improve your revenue by not providing the like required lab tests and radiological tests or any review tests, because doctor cannot learn each and everything in your mind every time. If you are taking around and the system is supporting you that this is required, AI is supporting you, this investigation required based on data, facts, and past history, medical history, family history, the risk factors, their provisional diagnosis, their lab tests. So like integration will help empower doctor, manpower, nursing staff, lab staff, every operational staff, maybe in medical, paramedical, or non-medical. And by improving all these things, definitely the top line, bottom line, if you give my example of my hospital also, we are having a chain of hospital in Noida, and we are growing at a CAGR rate of 64%. This is 4 times that in the industry. Our EBITDA is between 25 to 30%. Our patient reviews are 4.7 in all the platforms, more than 20K reviews on all the online platforms. We talk about the accreditation rate. We are one of the fastest growing hospital. We are the first hospital who got NABH accreditation within 9 months of its operation. We are the first operation who has got nursing excellence NABH accreditation, emergency NABH accreditation. I think it helps in your brand value also, in positioning also, so that footfall of customers will increase, they will have a better experience. So I think all these factors, they will improve the top line and bottom line if you implement all these things.
Thank you, Dr. Gupta. Absolutely, I agree with you. And I remember at this moment when Bill Gates said, the advance of technology is based on making it fit in, so that you don't really even notice it. So it's part of everyday life. Absolutely. As we leverage these tools on this high technology in our healthcare delivery, as much as we can get benefits from that. Let me just briefly go to Dr. Sirda and ask you, Dr. Sorry, I would like to ask you, Doctor, as you mentioned that one of the main challenge in terms of applying these two concepts in daily healthcare providing is the rural areas, and these areas which away from city centers and also other related services in APAC region. How can, Doctor, business transformation and operational excellence improve access to healthcare at these rural areas?
So thanks, Dr. Ismail. Hospitals will still propagate in spending the capex and making it a model of return on investments. But the frugal innovations and the screening programs, and particularly the point of care technologies. So these are all some of the asset-light models will be the models which will be propagated so that the hub and spoke is all being managed effectively, because we understand the developing countries and the rural areas will have the resource constraints. Nevertheless, the support from the command center and the major hub should be the primary lead in the tele programs and creating those kind of value streams in the market. So anything, but I still believe the digital solutions can really create an impact while they come with better cost optimization projects, and we feel that if it has been delivered very well, so we can really build up a very strong solution, because it has got the network effect compared to any other solution. Digital solutions will have the network effect, and it really builds up exponentially the value streams if it is properly incorporated. So it's all about the adoptions which are all done, and even on the tele segments, we consider that even in the APAC region, the adoption is to the tune of 40 to 60% in this 2023-2025. So while the adoption rate of these programs will go up, and the patients' lives and the impact will be really built up in years to come. But anything which on the digital segment, which I would like to say is, it has to be more ethical, safe, secure, reliable, equitable, and sustainable. If we believe in these concepts, and that will really build up the entire journey faster and better. Thank you.
Thank you, Dr. Sirda. According to the time limit, time is moving so fastly with you. Doctors, I will just select two questions from the audience. Sure. One for you, Dr. Gupta, one for you, Dr. Sirda. Let's just move with you, Dr. Sirda. There are a question from Momita Bajat. Sorry if I just have incorrect names. Anyway, the question is why, you can find the doctor on the chat.
Yeah.
Why ABDM adoption is low in private hospitals when it helps in offering better healthcare to patients in India? Why ABDM adoption is low in private hospitals when it helps in offering better healthcare to patients in India?
Would you like to take Dr. Gupta on that?
Yes, I can speak. Should I?
Yeah.
Yes, please.
Okay, so ABDM is Ayushman Bharat Digital Health Mission. That is one of the most ambitious digital transformation program of Government of India, and it has a vision that every Indian, 1.4 billion Indian are there in. Every Indian should have their data, healthcare data digitalized in a system, and every healthcare provider, being a doctor, nursing home, hospital, they can access that data with the consent of the patient, so that there should be interoperability between the student hospitals and doctors, and there should be interoperability between the similar hospital. There are different stakeholders, they can access the data to provide safe, quality healthcare. This is the mission and vision of that ABDHM. Challenges are what are challenge. There is a less education and awareness from the government side. There are like thousands, lakhs of the healthcare providers. They are right now in tier 1, tier 2, and tier 3 cities. They don't know, they don't have technology enabled tools with them. They have HIS. Most of them don't have HIS also. And the HIS is not that competent enough so that all parameters, all things can be adopted. I think there should be strong movement from the government side. They should involve stakeholders like Quality Council of India. They should involve NABS. They should involve big stakeholders, big hospital players, and there should be conferences, CME, workshop every time, and there should be some timeline, deadlines for rolling out of this ABDHM, implementation, reviewing and auditing. There should be some incentivization program. I think government is already working on that. So I think these all measures should be taken to implement this ABDHM in healthcare sector, because it is a win-win situation for hospital providers, for patients, for the employees, just with a single mission that there should be patient-centric approach, patient-centric healthcare service delivery.
Oh, okay. Great, Doctor. Thank you so much, Dr. Gupta. I also move to Dr. Sirda. There another question came from Dr. Wasim Gori.
Yeah.
Ask how, and he is just wondering how artificial intelligence powered on digital transformation is impacting on business transformation and operational excellence in healthcare delivery.
Sure. So if I take some use cases, it's like it's more on the prediction analytics, and so the AI algorithms really help in the predictions. So if I take into consideration the early warning signs, and before any met call or more like a code blue happens, we need to have the preventive mechanism in place. So the early warning signs and some AI tools which we have deployed, and it's been available in a few of the hospitals where they have embraced this technology, and we can predict and correlate if the patients are getting into the early disastrous signs. So that's something which will really circumvent and combat those kind of a problem statement in place. The second thing is also about some forecast, which helps. For example, now it's all about most of the quaternary hospitals are full and they are running on a full occupancy where. So the AI algorithms helps in the advanced on the average length of stay predictions, and it's more towards the prediction modalities of even the disease algorithms. So you will find that so those kind of mitigation tools are also existing. There are risk scores available. So the AI-based risk scores are also being in vogue, where it helps in predicting the disease at large. So those are all the 3-4 cases which we have seen. It really helps in building the efficiencies in place.
Oh, great, Doctor. Thank you so much, Doctor. I would like just to give you, both of you doctors, let's say 1 minute for each if you would like to add anything to this high quality discussion. I like it so much, honest, and I hope, inshallah, we provide some valuable information to the audience. So yes, please, let's start with you, Dr. Gupta. You have 1 minute if you'd like to add anything.
Thank you so much. I think it was one of the best discussion we have, and I think the speakers, host, and the audience will get a lot of value from it. And definitely, this is an era of high technology. This is an era of AI, ML. This is an era of robotics. This is an era of AR, VR. This is an era of like customer-centric approach, patient-centric approach, and we should all be prepared ourselves, prepare our system, process, prepare our team to adopt all these things as early as possible, because there is a disruption going on. Within 1 or 2 years, we will see AI will be incorporated, inculcated in each and every step, in each and every process. If you are not ready for that, you will be disrupted, you will be eliminated. So I think we should have a very positive mind towards the using technology in your department, system, and process in your team. That is, I think, most important point.
Great. Dr. Sardar?
Yeah, to complement both of you, sir, it's like while we have seen that EMR and all have been coming up in a bigger way with different integrations of AI layered solutions, the EMR adoptions needs a better facelift, which will happen in various regions, because user adaptability and overall adoptions to the records will go up as we see. The second thing is also on the coverage. While we see the insurance players are being quite pushy on their reimbursement model, so we'll find that the hospitals' profitability will squeeze. So the DRG, which has been common in some of the countries, will be rolled out in many other countries. So that will be other costs per episode being covered. So healthcare players have to become efficient as we go, and we have seen in some Middle East countries also adopting the DRG. So the regulatory authorities and the insurance players will try to reinforce this kind of models to come in. So that is more towards how hospitals will try and see how they can have efficient process. And third thing on the climatic change, because that's something paradoxically which I would like to close here, is like world healthcare systems account for 4% of the global CO2 emissions. So this was produced in the latest study, and this is higher than the aviation or shipping. So it's more towards the green and sustainable solutions which all healthcare leaders have to build in years to come. So I thank both of you, and it was really insightful conversations.
Thank you so much, guys. At the end of this discussion panel, I would like to thank both of you, Dr. Gupta, Dr. Sardar, and also my dear Imran Khan and all other staff.
Thank you so much. Thank you so much. Have a great day.
I hope you all the best, guys. Hope inshallah see you soon in other scientific conferences and forums, wherever, whenever. All the best, guys. Have a great
Thank
day.
you, Dr. Ismail. Thank you, Dr. Gupta. Bye. Thank you, everyone.
Bye-bye. Thank you.
To our live attendees, this is a quick notification that we are taking a short break of 15 minutes, and we'll be back again with session 2 with our panelists and speakers to keep you engaged, inform you more, and give you more insights about their experience and expertise in business transformation and operational excellence for the healthcare industry. I look forward to welcoming you again in another 10-15 minutes. You can use the same link from the lobby to join the session 2. And we will start in next 12 minutes from now. Thank you so much.